Hello and welcome to the Swine Disease Reporting System. This is the report number 84. My name is Guilherme here at the SDRS studio.
Hello, my name is Giovanni of the SDRS.
Hello, Daniel Linhares, also with the SDRS team.
And today we're going to cover the findings of January 2025, the first month of 2025 for the first report. And today we have the pleasure to have here Dr. Paul Yeske join the SDRS podcast today. Dr. Yeske has more than 30 years of swine veterinary experience where he has gained recognition for his work with disease management and elimination. He also earned several awards, including the Howard Dunn Memorial Lecture, Swine Practitioner of the Year from the ASV, and also the Science and Practice Award from the Iowa State University. Dr. Yeske is a senior veterinarian at the Swine Vet Center, which includes other 15 veterinarians specializing in swine medicine. In today's episode, Dr. Yeske will discuss the SDRS findings of the month and also a little bit of strategy of disease management. Welcome back to the SDRS podcast, Dr. Yeske.
Well, happy to be here with you. My pleasure to join the group again.
Thank you, Dr. Yeske. So to start our discussion, Guilherme, what are the findings for the month for PRRS virus?
Yeah, Giovanni, let's start with PRRS, our first page of the report that is having an increase in all the age categories, but mainly in the win to finish, we keep with over 40% of positive submissions for PRRS virus. This is normal in terms of the historical level of the data. In January, we have high detection of PRRS virus in the report, but which call our attention is that L1C.5 is still the most predominant lineage detected for PRRS in January and in 2025 nowadays. But the L1C.2 in 2024 had the highest detection of all the times, with over 400 detections of the L1C.2, which was the second most detected right now in 2025 when we look to the data that we have so far, even passing the Lineage 1A. So that's a thing that is atypical for this specific lineage. And we put together a bonus page with material about this lineage that is having higher detection, and even some distinguishing the genetic that he has compared with the historical L1C.2.
And I know that people will be curious to see what you have in the bonus page, but more so, people want to know what Dr. Yeske thinks about it. So what are your thoughts, experiences with this Lineage 1C.2, Dr. Yeske here, and if you can make some comparisons with your experience with Lineage 1C.5 that was also known as a bad guy here.
Yeah, certainly. As we talk with our producers and others out in the field, we're seeing more of the L1C.2 and being some pretty severe, clinically pretty severe outbreaks with very high mortalities, particularly when we have negative pigs and we get a lateral infection. With some mortalities plus 50%, and even in bigger wean to finish pigs. And so certainly feels a little bit more like a L1C.5 when it first came out back in 2020 or 2020, and certainly today appears to be a very significant virus and is moving around through the populations. It certainly makes you wonder if there haven't been some genetic changes, some recombinations that may have occurred. It'll be interesting as we continue to look at the diagnostics coming in, the whole genome sequencing. I think it reminds us the importance of making sure we go ahead and do some of that discovery work and understanding what's going on in these, particularly these clinically severe breaks, so we can better characterize the virus as we go forward and try and understand a little bit more what's going on out in the field.
Yeah, it's a good point that this Lineage 1C.2 or 0.5, this is all based on R5 only. And it's a good reminder that you bring to us, got to look at what's going on in the whole genome. And there may be some recombinations outside that R5 region, right? So if we look at the historic dashboards here, L1C.2, at least again, based on R5, is not new. It's being detected since several years back, but it's not until more recently here last year that it appears to be more correlated with more clinical signs, right? And is that your perception too, that the most kind of contemporary Lineage 1C.2 are different than the historic ones?
Yeah, absolutely. It appears that there's been some sort of change there, whether that's just some genetic drift or whether it's a recombination event that's occurred, but something's changed with the virus from what historically it was, and seeing some much lower CT values, a lot more virus circulation, and mimicking more what we see with the L1C.5 as far as the numbers coming back and the clinical signs. And so, again, it appears clinically to be different, even though it's having it's classifying in that same OR5 pattern, but definitely it looks like there's probably something that's significantly changed there.
Well, thank you for sharing out that, Dr. Yeske. What you are presenting for us, we had similar comments from other members of the advisory group. So for sure, it's something to keep an eye on and see how that progress in the field. Moving on, Guilherme, can you provide us some update on the enteric coronavirus?
Yeah, Giovanni, move to the enteric coronavirus. We have a slight increase in detection in PED in both cell farms and wing to finish as well, but a moderate increase for Delta coronavirus, mainly in the wing to finish sites. And again, this is within expected values when you look to the historical data. PED and Delta always increase in the winter time, so we are facing that right now. But when we look to the historical data every year, we try to take a look at the whole history of detection of the pathogen that we have in the report. And we see that a trend of PED detection decreasing year by year. So 2024 followed this trend as well. We had a lowest detection of PED compared with the other years. And we hope that 2025 we keep having this decreasing in detection for both Delta or for both enteric coronavirus.
Well, that's a very good comment there, Guilherme. Dr. Yeske, PED, there has been a lot of discussion about PED last year. There was this task force that was formed at ASV to discuss a process of eliminating PED of the U.S. swine industry, and you gracefully take over that and is helping to co-chair that endeavor there. Could you bring us and our audience up to speed where we are in this discussion about eliminating PED from the U.S. swine industry, and what could be the potential strategies to go forward to remove this virus from our farms?
No, appreciate that. And it's always good to see the numbers continuing to move down. And that's really part of what's motivated myself as well as others within the swine industry to go ahead and look at moving forward with elimination. And certainly, if we look at the Morrison Swine Health Monitoring Project, we can see that those numbers have stayed relatively low over the years, and it appears that it circulates more back into the wean to finish population, then gets back into leaks back to the sow farms. And so, again, I think we have to work on it as an industry-wide approach and continue to focus in on the biosecurity. With the cold weather we just recently had here, the real cold weather, it seems like every time we go through that, we always get a break in a number of wean to finish sites. And I know following up on some of those, it's always frustrating, even when we've set out the biosecurity rules, that we just want to keep the driver in the truck and try and reduce some of that crossover in those lines of separation, make sure we're continuing to keep those good lines of separation. But to get back to the PED task force, the group was put together, and first we looked to see what research gaps and have pushed out some calls for some of that information to help fill some of those gaps. And one of those being, and Giovanni, I know you've been working on that with Cesar Corzo to try and estimate the prevalence so we can get a good idea of what's really happening within the U.S. and try and get a number there that we can work with. We were able to pass resolutions at the U.S. SHIP to move towards certification, and at the U.S. Animal Health to explore control and elimination. So again, some nice objectives there to continue to work on. I think this next year we're going to be working with the U.S. SHIP staff to help move towards certification, try and define some of those parameters that we're going to be looking at in the beginning here, and try and continue to move forward here with elimination, not only control but elimination, and see if we can't take this one off the list, hopefully.
Good momentum, good infrastructure, and I take advantage of it.
And it seems like this program starts being a program that's going to be a certification side of the US ship there, then.
Yeah, and hopefully the US ship will help with the certification there. The producers will see the value in certifying their herds and being able to do the necessary monitoring to be able to do that. And as we move forward, hopefully we can continue to reduce the incidence and continue and prevalence here. And like I said, continue to work going forward to eventually get it to elimination, hopefully.
Well, great work there. Thank you for helping the swine industry once more, Dr. Yeske. Guilherme, what are the updates for Mycoplasma pneumoniae?
Yeah, moving to more good news regarding other pathogens in our report. For Mycoplasma, we have a substantial decrease in the positivity in the Win2 market in this month in January. And when we look to the 2024 and the historical data, it was the lowest number of confirmed tissue diagnoses of Mycoplasma in the ISU VDL, which means cases that the diagnosticians took a look to see if they have a confirmed lesion of this specific pathogen. And looking to the historical data, Mycoplasma was the lowest number in 2024. So good news for the industry that we are also being effective and keep this bug at least outside of our cell farms.
And the chart there is pretty impressive, right? You see the number of Mycoplasma hyopneumoniae confirmed lesions over the years, and it goes from here to down to, and 2024 was really confirming that trend. And that's another one we gotta look back to Dr. Yeske, because he's of course one of the international experts in advocates of Mycoplasma elimination, right? Let's get rid of Mycoplasma. Let's not talk only about control. And so as the industry moves to that, Dr. Yeske, do you see here in the near future the US being able to eliminate Mycoplasma from the herd? And if so, can you share some of your preferred methods to do so?
Yeah, certainly, and certainly would like to see that one be eliminated as well from the industry. But again, we've been fortunate to have good success there. And one of the good things with Mycoplasma is that we're able to keep the downstream flows negative as well. In some of the research work we're able to do, the reinfection rate, lateral reinfection rate of negative pigs placed in pig dense areas is very low, and has helped to drive that moving forward, and that producers can pick up that advantage because the pigs will stay negative in the wean to finish phase. But when I look at the herd closure, by far and away has been the most successful when we look at it, and the 240 days kind of being the backbone of that herd closure, making sure we get good exposure, call the day one accurately. And with the diagnostics today, with the tracheal swabs, we can do a better job of making sure that we're accurate with that diagnosis. And today there's many ways to do it. There's as many ways as there are practitioners, I would say, out there to do Mycoplasma elimination. But today, the herd closure, I like to do the medication more up front once we've confirmed exposure. And then we'll do some diagnostics at the back end to see if we need a plan B and to do a secondary medication at the back end of the closure as well, just to capture the benefit on the pigs quicker coming through the system. And so again, like I said, lots of different options, but the closure, the 240, making sure we get good exposure, confirming day one, the 240-day closure are probably the key factors there in being successful.
And on that exposure, I assume you're talking about gilts and sows, both?
For piglets and sows, yeah. For the gilts and the sows become so important if you're going to do even if you're looking at control long term, we need to be exposing those replacement animals really by the time they're about 10 weeks of age are about 50 pounds, so that they're no longer shedding by the time they get to farrowing, so we can keep that reduced number of that reduced amount of shedding as they get to farrowing their own piglets, and so that we don't get as much contamination from the maternal side. And again, that's the backbone of what we're trying to do with elimination, is take advantage of that immunity, get everyone exposed, develop that immunity, stop the shedding, and then we're able to eliminate it from the herds.
And another advantage I hear you saying is a lot of times you combine that backbone with other diseases too, right? So you piggyback,
Yep.
can take care of PRRS, control PCV, why not flu, right? And the other, so improve the general health.
Yeah, absolutely. We've piggybacked it on top of many PRRS closures. You're not adding, and with today's PRRS closures, it's probably the same amount of time. In the past, we added a little additional time to be able to get the mycoplasma, but today they're essentially about the same amount of time, and you pick up that advantage at the same time.
Thank you for sharing all that strategy there for mycoplasma, Dr. Yeske. Guilherme, what other updates we have for different pathogens that we monitor on the SDRS?
Yeah, Giovanni, let's start with influenza. That also good news. We are having decrease in positivity for the specific pathogen in both sow farms and Win2 market. In the Win2 market was a substantial decrease that we had in influenza positivity. And also looking to the last 2 months, influenza is not on the top 5, for example, of the confirmed tissue diagnosis in the ISU VDL. We are seeing other bugs like Passerella or Streptococcus suis or Glasserella passing influenza virus in terms of number of confirmed tissue diagnoses. So good news in terms of influenza. But in terms of PCV2, for example, it remains really high, the Win2 finish positivity for this pathogen, with over 50% of positive submissions for PCV2 in the Win2 market. And also, when you look to the data of the tissue cases submitted in all the VDLs, the CT values are coming really low compared with the CT values of 2-3 months ago. So something that we are monitoring to see what is happening in terms of PCV2.
Well, that PCV2 is very interesting one comment there, that you see more positivity, low CT values, and it has been coming up with some frequency of interval there. Dr. Yeske, as you have the boots on the ground every day, what do you think is associated with this change, drop in CT values of PCV2, more positivity at the end of 2024 and beginning of 2025?
Yeah, I think most of the times when we've seen some of the concerns and or issues there, when we see some instability in the sow herd, and again, going back and looking at some of the diagnostics, looking at abortion rates, because that can be one of the factors that pushes you there. Mummy rates certainly can be there. Stillborns are, all those things are some things we need to look at if we're starting to see some of those issues downstream in the wean to finish. And processing fluids can be another good monitoring tool as well to see kind of what's going on with that stability of the sow farm. And going back and reviewing vaccinations, sometimes we see some vaccinations, vaccination schedule deviations where some of the vaccines don't get properly done at the proper times or the proper doses. And so again, going back and reviewing that, making sure that what's set out in the program is actually being done. And if we've got some of that instability occurring out there in the sow farms, then going through and doing, we've gone through and done some whole herd vaccination just to get that stabilization back in line, going back and making sure that we get back on target with the vaccination for the replacement gilts. And so, again, I think those are the things that we want to go look at if we're starting to see some of that, because historically, once we've got a good stable sow herd and we've got good vaccination tools to work with this particular pathogen, once we've done those things, generally we're able to keep it well under control.
And that's it, guys. Thanks to Dr. Yeske. Really good episode today that we talk about PED elimination. We talk about PRRSV L1C.2 and also about PCV2 and mycoplasma. I hope you guys enjoyed the podcast today and see you guys next time. Thank you.
Thank you.
Thank you.
Thanks a lot.